Hello everyone, welcome to my channel once again. The channel name remains the same, the Nursing Student Channel, your favorite YouTube channel that deals with all nursing knowledge and education. If you are new, don't forget to hit the subscribe button and also hit that notification bell so that you get every new video that comes on the channel. So today, before we go on to today's topic, I would like us to refresh your memory with a simple quiz, just 60 seconds of a quiz. I'll drop the question here, then you pause the video, you solve it, and after that, I'm not going to give answers. I just continue with the lesson. All right? All right, let's get started. So like we learned from the last video, the diagnostic process is the one process that nurses use in getting all the nursing diagnoses, okay? And the diagnostic process, as we said earlier, is a 3-step process, okay? The first step is the analyzation of data. The second one is identification of health problems, risks, and strengths. And then the last one is the formulation of the nursing diagnosis, where we're going to talk about the 2-part, the 3-part, and then the 1-part diagnostic statement. So we're starting with the analyzation of data. After getting all your information through the first step of the nursing process, that's the assessment, you have to analyze your data. And by this, we are talking about comparing the data that you obtain from the patient, from patient relatives, from patient history with standards, okay? So all the information that you get, you compare them with standard information that you already have, as in information in theory, in books, by research, by experiments. So when you compare this information, that process of comparing the information is the analyzation of data. Okay, so you compare the information that you have from the patient with information that is already existing, that is standards. Okay, and then they're going to identify the gaps and the inconsistencies in the patient's information. Okay, so that you get to understand that there is a problem here or there is a problem at this place. All right, so basically that is the analyzation of data. And then the second step is the identification of health problems, the risks, and then strengths. So now you've obtained your data, you've obtained the patient information. How do you identify the patient's health problems, the patient's risk problems, the patient's strength? That is the second step of the diagnostic process. Take note, we are diagnosing the patient, okay, as a nurse. That's okay. All right, so now that we have our information, we've analyzed it through the first procedure or the first step, then now we are going to, with the help of the patient, identify the patient's strength and the patient's problem and even his risks. Okay, if you as the nurse identify a patient problem without the patient agreeing that that is a problem, unless it is an objective problem that you can see or observe with your own eyes, it isn't a problem. Are you getting it? So if you, the nurse, identify a patient problem or a problem for the patient, and the patient does not agree that it is a problem for him or her, don't write that as a problem. Because, for example, you can't identify a problem for me when I think it is not a problem. So you don't just decide for a patient his problems, his strength, and his risk. You have to go into agreement with the patient in order to accept that this is a problem, there's a risk, and this is a strength. A patient's problem that you might think is a problem might be normal for the patient. That is why you can't decide a patient's problem for him or her unless he agrees with you. So in identification of your health problems, the risks and the strength, you have to do it in conjunction with the patient. The patient has to agree to it. What the patient tells you is their problem, you have to accept it because it is the patient himself that knows what is wrong with him. So if the patient comes and the patient says that he's not able to empty the bowel, And you ask the patient since when, and the patient says that he's been able to empty the bowel only once a day since the past 3 days. You don't have to see it as normal, because maybe per the patient's history, the patient goes to empty his or her bowel 3 times every day. So since it is one a day for the past 3 days, the patient sees it as a problem. And that is actually a problem for the patient, not for you. Are you getting it? So you just work on it. So whatever that the patient thinks is a problem for him or her, don't throw that away. Don't throw that away. Keep it and then work on it as a patient problem. So when you get those problems, that is why we have prioritization in arranging your problems. So in prioritization, you can bring those problems that are not very risky at the very end, so that you focus more on the immediate problems that are risky. Okay, but never throw the patient's identified problems, risks, and strengths away. And then after identifying our health problems, risks, and strengths with the patient, then we have to classify those problems into nursing, medical, and collaborative diagnosis. We've done that already. We've identified the differences between the nursing, the medical, and the collaborative. The reason why you have to do that is because, first of all, the nursing diagnosis focuses on the immediate nursing problems of the patient that needs immediate intervention. And then again, when you are writing your nursing diagnosis, it said that in the part 1 also, you don't have to use medical diagnosis in it. Okay, so you can't say that a patient has amputation. No. You can't say that a patient has malaria. No. That is the doctor's diagnosis, so medical diagnosis. But then when a patient has amputation, your diagnosis is going to be impaired body image, altered body image, or impaired mobility. Okay, you look at, like I said, the symptoms of the patient, not the condition itself. So the patient has an amputation. If the patient has an amputation, how is it affecting the patient? For you, the nurse, to identify. And that is an altered body image. The patient had 2 legs, now he has only 1. It's an altered body image. The patient used to walk very actively, but now he can walk by himself. That is also a disturbed body image, and then also impaired mobility. Are you getting it? So you have to identify and then classify your problems, your risks, and your strengths into these various categories: the nursing problems, the medical diagnosis, and then the collaborative diagnosis. Like I said, the collaborative is a problem that it needs all hands on deck. So those problems normally we identify them or deal with them by using the other diagnostic procedures like the X-rays and those things. Okay. So now let us move on to prioritizing our health problem, the risks, and then the strengths. One thing that you should understand, like I said earlier on, is that the problems that a patient and yourself may identify may be many, okay, but not all of it are emergent problems or urgent problems that need the nursing care to be focused on. Okay, so you have to prioritize your patient problem, the strength, the risks, and then every other thing. Now, in prioritizing the patient problems, one thing that you should always take note of is that we want to try as much as possible to deal with the patient's very urgent problems first. Okay, so in prioritizing, I'll give you about 3 rules that I think might help. The first rule is the ABC rule that we all know of. That is the airway, the breathing, and then the circulation. So when a problem comes to the ward, the first thing that you should check, especially in the emergency ward, is the ABC, the airway, the breathing, and then the circulation. Differentiating between the airway and breathing sometimes is a little bit complicated, but then one thing that you should understand is that with the airway, we are talking about usually airway obstructions, things that prevent gaseous exchange, that is breathing, things that prevent breathing. So we normally use one example of an airway diagnostic is the ineffective airway clearance related to something and then as evidenced by something else. And then for the breathing, it usually deals with the respiratory rate. Okay, so we have impaired breathing pattern, altered breathing pattern, like that. Okay, so those ones deals with tachypnea, dyspnea, bradypnea, and that kind of thing. And then the second one that you can use is the vital signs. So the vital signs is the temperature, pulse, respiration, and then the blood pressure. Okay, and then don't forget that the fifth vital sign is pain. So you can prioritize your problems by focusing on these major four vital signs: the temperature, the respiration, the pulse, and then the blood pressure. All right. And then the last rule that you should always take note of is that risk diagnosis, no matter how risky that you might think it is, always comes after you have dealt with actual problems. So if a patient has the risk of collapsing or whatever risk that it is, never prioritize a risk problem to come earlier than an actual problem, because you should take note, no matter how insignificant and how small a problem is, an actual problem is, it can exacerbate in a simple matter of time. So no matter how small the problem is, always make sure that you deal with actual problems before you proceed to deal with risk problems. So always make sure, if you're having patient problems, make sure that you always have your actual problems coming before the risk problems. All right. And then also understand that the patient problems must conform with the patient's strengths. So if the first problem of the patient is, say, headache, then the strength of the patient, the first strength of the patient must also focus on dealing with the headache. Do not mix up the strength and the problems. All right. Good. So we'll end here for today. Another time, God willing, we are going to move on to the diagnostic statements, where we're going to do with the 3-part, 2-part statements, and then the 1-part also. So have a nice day. Thanks for joining me. Keep learning and have a nice life.